thanks to all of you for coming and spending some time here. It's really great to be back here at UCLA. When I was in the public service, when I was in the School of Public Health, most of the people wanted to be academics and write for grants and get tenure and all of that, and I didn't. And so it's really cool to be back here under the auspices of the company that I'm now belonging to, and giving some information and sharing some stories with you. So thanks for coming. It's great to be here. Salesforce is doing a lot of things in healthcare, and I'm going to talk about that, but really the goal here is to be more edifying and sort of to give you our perspective on how we see the world changing and what we see happening. I put a bunch of pamphlets on your tables because I frankly printed a bunch of them out, and I don't want to bring them back up to San Francisco, so feel free to take a look. And I'm a big believer in giving people all the information. I don't think it makes people disinterested. I think it makes them more interested. So feel free to look and read and tune me out if you want to look at the pictures. They're pretty good. But we'll have the pictures up here too. Excellent. And I'll try and stay close to the mic and close to the laptop here. So, because we're a publicly traded company, we have a safe harbor statement about forward-looking statements. And the point here is that I'm going to be talking about some things that aren't available yet. They will be soon, but they're not available yet. So make your investment and purchasing decisions based on what Salesforce has to offer today. And with that, let's talk about healthcare. Salesforce has done a lot of different things. We're a big company, and we have a lot of stats about us. But one of the things that I really wanted to impress upon you all is that we have a different way of doing a lot of different things, whether it's the business model or a technology model in the cloud, but also the philanthropic model. And this is also something that is near to my heart because it's something that started because of a relationship I had with UCLA. We have a philanthropic model. It's the 1-1-1 model. 1% of our equity, 1% of our product, and 1% of our time we donate to philanthropic organizations. We all get paid about a week's worth out of the year to donate our time to various organizations. When we do it for soup kitchens, when we build bikes, when we put together care packages for veterans overseas, it's great and meaningful. But when we do things for healthcare, it has something extra to it. And so what you see here is a picture on the left side. It's partially covered up by the graphic, but you see a picture of Care Harbor. Does anyone here know what Care Harbor is? Has anyone heard about this? So every year since I've been at Salesforce, actually, it was the first year that they did it here in LA, some pretty excellent people take over LA Stadium in South Central LA, and they give free medical care to about 4,000 people throughout the week. On the first day, thousands of people line up because it's the only place they can get care. And they get wristbands, they have numbers, they get appointments, and for the rest of the week, they get mammograms, they get glasses, they get teeth pulled, they get physical exams, they get referrals to secondary for specialty care, and they get it all for free, all in the stadium. And the pictures are available online, the videos are available online, and a lot of the information technology that runs this event comes from Salesforce. I got a call after my first year at Salesforce from a guy named Michael Rodriguez, who's a professor of medicine in the family medicine department here, and he said, we got this thing, and can you help us out with it? So the first year we managed all the entry and the intake, and then we managed their information capture. They had some paper that they were using to take them through the stadium to capture what they were doing, and then they would take that paper and they would fax it to themselves, or they would do a fax, an e-fax sort of attachment to the record in Salesforce, and then people would do data analysis afterwards. So for lining up, for getting the appointments, for following people through, and then analysis afterwards, they use Salesforce. Over the years, it's gotten more robust. They have iPads now, they have scanning devices now, and it's getting even better. So it's something that we're proud of and something we take seriously. So a lot of people don't know about Salesforce and healthcare, and I just want to sort of, this is by way of giving you some of our credentials. Salesforce doesn't have all those letters after its name, so I got to tell you why we belong in healthcare. We've been doing this for about 16 years, and from the very beginning of our company's history, we were selling to healthcare, and what you'll notice is the bottom half of this page are the life sciences companies. It should not be surprising to you that life sciences companies, like Salesforce, are at our core. We started off as a Salesforce automation technology or something to help people sell. And the bottom half of this slide has obvious ways of selling. So the pharmaceutical companies and the medical device companies started using Salesforce for sales. Pretty simple. And then the payers started using us for sales, but they were selling to employer groups. And then the providers started using us to build physician referral networks. Because when you think about it, hospitals sell to physicians. They sell services, and the physician referrals, the referral network keeps them in business. And then something really cool happened. In that upper quadrant, in the provider quadrant, there are also a bunch of people that do ancillary care. You can see Kindred in there now, but there are a whole range of folks that do home health, physical therapy, respiratory therapy, and everything in between. And those folks have both a sales function and a clinical function. So they found that in order to get paid, they had to put together all the clinical data, connect it with their sales data, and get reimbursed. And that's when people started putting patient data into Salesforce. And then something cool happened with the payers. They woke up one day and they all of a sudden had to start selling to individuals. So they started selling to individuals, and then those same individuals became part of their disease management. And then they started putting patient data in. And then the biggest surprise to a family doc like me was that the life sciences companies started doing it too. Because now, they don't just want to sell a pacemaker or a drug or a molecule or a device. They want to sell the outcomes around it. Those things that they've been selling for many years are now commodities. And so now they have to sell services. And so there's a whole burgeoning field called patient services. Whether you're taking a very expensive drug or a very cheap drug, the outcomes are starting to matter more and more. And so the life sciences companies are putting patient data in too. And so what we're finding is that all of these quadrants, a bunch of logos that you probably recognize, are all using Salesforce in one degree or another, either for sales or for patient care, or in many cases, which warms my heart, both. It really warms my heart, seriously. Okay, so why is this happening? What's going on here? And this is where we'll talk about some of our perspectives in the world. You all know about these forces. There are three main forces that we sort of organize into. The first are regulations. This is whether they come from the payers or whether they come from the government. This is the ACA. This is 17 million new Americans with health insurance. This is value-based reimbursement. But one of the interesting things that's happening because of this pressure is competition. And so we're finding a bunch of our hospitals responding to this in a bunch of different ways, whether they're trying to build loyalty or satisfaction, or in some cases really deliver on the promise of value-based reimbursement and outcomes. The second arrow on the right side are consumer expectations. This is the easiest one to communicate because every one of you has a smartphone. Almost all of you have used Uber. Almost all of you have used Amazon. And then you show up in healthcare, and it's like those escape ramps that the trucks have on the highway, where all of a sudden you slow down, and we're disappointed. And so the consumer expectations, while they weren't as important in the past, are now becoming more and more important, whether it's because you want to engage someone and attract them, or whether because you want to hold on to them as a customer, or anything in between. Finally, the clinical innovation is the top arrow, and that's the thing I think I like the most. And there are three basic ways that this happens. One way is very expensive, sort of far out, super cool treatments, things like precision medicine, genetic analysis of tumors and targeted drug therapies or immunotherapies. Even those very high-end therapies need support. They need education, adherence, anxiety. People have anxiety, they ask questions, and you got to answer those questions, and all of those things are important. But even for more prosaic treatments like insulin, we see a huge variance in how people do, and they all take the same insulin. What's the difference? Patient activation, socioeconomic factors, support, and social networks sometimes. And then another facet of this is all of the other places where you can now get care where you didn't used to be able to. So whether it's a surgery center for your colonoscopy, or a CVS for a flu shot, or all kinds of other things that you might be getting at home, telemedicine at home, or anything in between. Again, there's all kinds of different ways of getting care. It gets really fun when you start combining these, when you think of competition and new ways of getting care, or you think about consumer expectations and how they might impact a new clinical innovation. So when we see all of these, we see a lot of change. I think you probably see those also. And with every one of these, we see the response being, the appropriate response being focusing on the patient, organizing around the patient, and doing things that they might like and expect. And so we talk about it as precision healthcare. It takes its name from precision medicine, and I don't think it's such a novel concept. I think we thought it up ourselves, but I was talking to the dean of the Stanford University School of Medicine, and he has the same idea, which is great. It's a great idea. Instead of precision medicine, which is genetics to treat cancer, precision healthcare takes a variety of different kinds of data, and it brings it together to try and do a better job with the patient. Not only to treat cancer, but sometimes to prevent cancer. As most of you know, if we had everyone stop smoking, we'd get rid of 90% of lung cancers, and we'd get rid of probably about 30% of all-cause cancer mortality. So it becomes an issue of wellness and behavior change and support and education and all the things that the EMRs don't do. And here's why. Legacy technology, most of you have been in health IT long enough to know some of these old systems, whether they're the old revenue cycle management systems or obviously the EMRs. They were all started to capture revenue. The revenue cycle management systems were big, clunking systems in the basement. We were just talking about that earlier with a CIO who'd been in the business for a long time. And these were old systems, but they made money, so people were happy to invest in them. The next layer came the EHR. Again, when people were selling EHRs back when I was a resident, maybe some of you remember this, they were selling on the basis of being able to increase people's reimbursement. They said, we can help you add up body parts that you've examined. We can help you add up diagnoses so you can increase your reimbursement. You don't hear that anymore, which is cool. But the problem is that the EHR really wasn't built for the kind of modern problems and the modern technologies that we have today and that we sort of listed in the previous slide on the pressures. It's not good for sending a text message. It's not good for collaborating, much less collaborating outside of the institution. And it's not good at responding very quickly to the kinds of things that are changing every day, whether it's a new diagnosis or a new way of treatment or a new social impact or a new mission in the hospital. We all know hospitals change slowly, but I think EMRs change even slower. And so when we figure out what do we want to add on top of it, we've got a cute little trick. We follow the R's. So in the first stage, people were following the R of reimbursement of revenue. Secondly, they were investing in records, and now we find they're investing in relationships. And they're investing in relationships because of the exact pressures that we were talking about before. What we see people doing, we see CIOs all over the place investing in technologies to make it easier for them to reach out to patients, to reach out to their physicians, to family members, to try and do that comprehensive care. We see people like David Feinberg. It's great to be able to talk about David Feinberg, who was the former CEO of UCLA Health, as many of you know. He's now at Geisinger, and he's been very public about offering a money-back guarantee for patients that are dissatisfied. It's almost unheard of in healthcare. It's close to the value-based reimbursement and outcomes, and so it's not so radical, but it's still pretty radical, and I really give him a lot of credit for it. People want these components on the right side that you see. They want it to be in the cloud because it saves money. They want it to be mobile, obviously, because that means it's available everywhere. Social means you have to bring together people, whether it's people on the inside of an organization or family members or partners in the community. Data science, we all know, we hear plenty about that. And IoT, I think health devices are a little before their time, but they're starting to grow. They're starting to get better and stronger, and they're starting to actually start to bear on the treatment of some people. And so this is not a theory for us. We've been doing this for a number of years. We've had a bunch of people take Salesforce out of the box, realize that it's a customer relationship management platform, and they've customized it to take care of patients. So Johns Hopkins did it, City of Hope did it, UCSF did it. A bunch of other folks have taken that and figured out how to do it. But not every organization has the capital or the intellectual wherewithal or the staff or frankly, the guts in some cases to do this themselves. It's hard to do and it can be risky. And so what we've done, and the thing that we're really proud of, is announcing a new platform, a new application that we're calling the Health Cloud. It really is aimed to do a few important things. It's aimed to bring a bunch of data together, this view that we're talking about. It aims to help with patient management, and it aims for patient engagement. And I'll show you a little bit about how to do it. But the key take-home message, I don't want to be about Salesforce. The key take-home message is I want you to think about this being an example of the next platform in healthcare. What we've seen for a long time, and when I was practicing at UCLA, it was only 7 years ago when we were using paper. Third best hospital in the country, and the family medicine clinic was using paper. To go from paper to a digitized system in something as complex as healthcare is very difficult. And I think we're really glad that organizations that we all know of, the EMR vendors, did a really good job doing it by forcing people to do things a certain way, which is great. But now we're at a time when those problems that I was talking about earlier require everyone to do things in different ways. Some people want text messages. Some things are going to be applied to orthopedic surgery or cancer or wellness, and these are all different enough that they need different processes and different systems. And so the point here is that I think we're the first example, which means we're the best example, of this kind of platform in healthcare, which is going to be an open platform, it's going to be a social platform, it's going to be mobile enabled, it's going to have data science built into it, and it's going to have the flexibility to include varieties of data and varieties of use cases, and I'll tell you a little bit about that soon. The first sort of picture I wanted to just point out now, just to talk about some of what those functions might be that exemplify this new platform. On the right side, you can see it, and you can see it on your sheets if you have it on your table, and there's some sheets available if you don't have them. It's sort of a care team map, and it's something that we got really good at outside of healthcare, because frequently when you're a customer and you call up a company like Dell or someone else, and you've got a problem with your monitor or your computer, they have a partner nearby, a fix-it shop, who could fix it for you, and they have to coordinate that case. So we figured that out, and that's very similar to what happens when a hospital discharges a patient, and there's a respiratory therapy company or a home health agency or a physical therapy organization that has to bear on that patient. It was a great theory for a long time. Now there's going to be money to it. Many of you know about the joint replacement bundled payment that's going to be coming from CMS. Instead of old fee-for-service medicine, where everyone's incented to charge as much as possible to the government, they're going to give a big bolus of money to the surgeon and the hospital that does the procedure, and to make them responsible for the nursing home, for the physical therapy, for the home health agency, to follow up on the care, and everyone's going to be measured on outcomes. So now there's money, there's actual reimbursement for the kinds of systems that can support bringing people together from different organizations. Another great example of this, there's a research study happening at UCSF where they're taking care of people with Alzheimer's. As many of you may know, the biggest projected increase in CMS costs in the next 5 or 10 years is from Alzheimer's care. And so they're not using this to connect to patients directly, and the doctors don't really have enough time to do this. It's for nurse navigators to connect to the caregivers at home, whether it's a home health nurse or a family member. And again, it all can happen around that same kind of network diagram. Another cool picture is something that is a timeline. It's sort of vague. It's sort of hard to see it there. I think your picture is probably a little better. But the idea is this is a timeline that has a bunch of clinical data, but also engagement data on there. Data that might come from the EMR, which is important for context, but also if someone made a phone call because they had a question, or if someone filled out an assessment because there was the importance of doing some surveillance or satisfaction survey for the patient. We came up with this idea after I'd spent a bunch of time, and I was an urgent care doc for a long time, and I was always afraid that I was going to see someone in 15 minutes or 10 minutes who'd been smoking for 40 years, who kept coming in with a cough. And we were all going to treat him for a simple cough, give him some Robitussin maybe, but it was going to be something worse than that. We wouldn't be able to see that if we were looking at a long list of dates, or maybe if we were not even able to look at the dates through papers or records that we had to drill in on. But on the timeline, it becomes all available instantly. On the bottom part, you might see a care plan. These are care plans and protocols that we're putting in our system that are aiming not to support order sets or certain drugs or procedures or the kinds of things that you might think of as decision support in the hospital. These are the things that have almost as much, if in some cases, more bearing on the health of a patient. What happens before they come in? Did they prep for their colonoscopy? Did they prep for their surgery? What happens after they go home? Do they have support? Is there an oxygen tank waiting for them? Are they measuring themselves? Are they weighing themselves? Are they taking their medicine on time? Are they responding to the surveys and the need for that kind of engagement? All of that fits on the timeline and the care plan. This is a Today page. This is sort of interesting because it looks really simple. This is the page that, say, a care coordinator would log in on the first day. Another facet of this technology and the platform that I think we're coming up with that's valuable is that this is not only for doctors. In some cases, it's not for doctors at all unless they want to sort of look and see how good their patients are doing. This is for care coordinators and nurses and social workers. It's for psychologists. It's for intake coordinators. It's for the chief nursing officer in some cases. And the idea here is it's all about people and it's intuitive. It's all about people means you can see your patients on the left side. You can see a chatter feed, which is our system of communication. It's like a Facebook feed, sort of. And it's intuitive. People like to use it, and they don't have to train. And as the CMIO of UCSF told me, Josh, we keep getting older, but the residents keep getting younger and younger, and they demand these kinds of technologies to communicate. He said, did you know that email is sort of passé? And I sort of reluctantly admit that I know that, but I like it still. And then, of course, because Salesforce is customizable, it's all customizable. And then, of course, it has to work on an app, on a laptop, on an iPad, on a mobile device, on an Android device, and everything else you can imagine. And so Salesforce is sort of native to all of these devices in one way or another. It's very important to give information to patients. They like using mobile devices to look at it, and it's been very successful. So the point here is that whether it's any of these different screens, I think you're going to find some of these things popping up over and over again, and the importance is to bring all the data together. I don't know how much longer I have. Does anyone have an idea about how much longer I have? Great, then I'm going to talk for like another 3 hours. So I want to talk a little bit about how we do this and why we're in this good position that we can do this. And once I get close, someone just sort of let me know that I'm running out of time. We start off with this cloud-based platform. Now, cloud-based technology in healthcare is sort of new. It's been something that people have been a little averse to over time, but I think that's changing. And it's changing for a number of reasons. One, because there is a security benefit to having a software company that only focuses about software and security and connectivity do that, instead of, say, the IT departments in various hospitals, which could never do the same kind of job. There's also a benefit in cost. Instead of having to support all the servers in your basement, someone else takes care of that, as well as flexibility and disaster recovery and all the things that you get from cloud computing. The layer above that is our CRM layer, and this is where we've built our products historically. We have technology for marketing, for sales, for customer service or like a call center. We have a communities app, which is sort of like a portal access for customers and partners. We have analytics that adds to it, and now we just announced an IoT cloud to get a bunch of device data. The point is that all of these technologies are sort of on the same platform in a way, and they're really aiming to help your companies and all kinds of companies, whether they're in healthcare or not, with the entire life cycle of a customer, to reach out to them, to do a really good job when they're in front of you, and do a really good job when they're home, and ongoing for as long as you might have that relationship. CEOs are being told right now, and this is coming to healthcare more and more, we're hearing from hospital CEOs who are telling us, the board just told me that I have to run my hospital like a business, not like a healthcare business, but like a real business, where I've got to reach out to customers, and I've got to do a good job taking care of them, and I've got to build loyalty so they come back to us over time. And they have none of the technology, they have none of the tools, and they have very little experience in how to do that. So we're being asked to do that more and more. The layer above that is this complete patient relationship management layer that we're calling the Health Cloud. We announced it in September. It's going to be released for availability for purchase very, very soon. And we're really excited about it. And the point is that it really applies to every segment. And we have great examples of payers and obviously providers, but also life sciences companies that are using it and piloting it right now. It can be used before, during, and after care. Remember, keep in mind the before and after is really important. We've got great examples there. It can be used for any goal. So the point is it could be for value, but it can also be for satisfaction. We're in 4 of the top 8 hospitals in the country. We run the concierge care and executive health care for 4 of the top 8 hospitals. UCLA is one of them, and we're really proud of that work that we do. It's very easy to understand Salesforce in the context of concierge medicine, but it's a great way that healthcare organizations learn about Salesforce and then can grow with it. And then finally, it can be for clinical care, for administrative care, for research. We've got some great use cases and great stories from UCSF. We've got a great mammogram story about mammographic screening, but one of my favorites, especially when I'm down in Southern California, is the California Teachers Study. They were following 100,000 teachers to see who got cancer and who didn't, to try and keep them healthy. 20,000 of them were chosen to get blood samples and genetic samples. This is all done at City of Hope. Great study. And they used Salesforce to collect those samples. And there's a great video. You can check it out online. And it shows a nurse driving to someone's house, opening up a bag, taking out a vial, taking a blood sample, scanning it. It automatically loads into Salesforce, and everyone can follow the workflow over time. It saves money, increased throughput. It was really a benefit. So for research, which again is close to my heart because of my training, for clinical care, again, close to my heart because of training, and administration, close to my heart because I'm a patient too sometimes, and I like not waiting, and I like things to be smooth. We're finding people using Salesforce. I want to say a couple words about trust. We tend to be shy about trust. We don't really talk about it because it's tricky and it's hard. There's no finish line in trust. This is sort of a world that we're going to be inhabiting forever. And I wanted to sort of speak proactively about the kinds of things we do to build trust and security and privacy into our system. We're trusted by regulated industries. We were just talking earlier about how HHS was using Salesforce to manage their, the first stage of the Meaningful Use Program. And so some of the regulators use us. We're being used by a bunch of government agencies and a bunch of folks that are have very high standards. Again, we built a lot of the security and a lot of the privacy in our system not for healthcare. We built it for financial services and a bunch of other industries that were very exacting. And we found that with some additional, but not too much additional work, we're able to make this very applicable to healthcare. And then finally, we have specific things that we've done in healthcare for healthcare, including a new product that we have called Shield. And just to go into a little more detail, just so you know what you're getting when you go to a cloud vendor in terms of security and privacy, there's a big list here of all kinds of things that we do all the time, out of the box for privacy and security. And some of the things I like the most are the things that you might not get from your on-premise legacy, maybe EMR technology. Something like penetration testing. We do it ourselves. We pay other people to try and see if they can break in. We have two-factor authentication that comes out of the box. We have all of our backup and disaster and all the stuff you'd expect, but we have customer audits. We let people actually look at our data centers and everything in between. You can sort of see a number of things that I think we do specially, and we've really had a lot of success with it so far, and we're fortunate, and we work very hard for it to earn your trust. And then finally, and here's another big difference, both in our platform specifically and also the platforms that I hope you look to in the future to try and solve the problems that you're hoping to solve. And that is that we're open, and that we're flexible, and that we're happy to have a bunch of partners. So in Salesforce, we have about 2,800 applications on our App Exchange, which is a place where you can go, that you can get services and capabilities that we might not offer ourselves. Something like electronic signatures that you might get from DocuSign. Something like e-faxes that you might get from a company called ZPaper that worked with us in the Care Harbor work that we did. And you obviously see the customers that we have, but we have partners, we have industry partners, and we have a whole range of folks that are helping us out. We realize we can't do this ourselves. If any of you have been to Health 2.0, or I'm sure even in this room we've got probably several, maybe dozens of folks that might be viable partners. Folks that have great IP to offer, great content, great expertise, but it's just too hard to get in the doors of the EMR. It's too hard to convince a CIO at a hospital to take a chance, spend a little money on integration to your platform or your work, and to bring it in. And that's one of the things we want to do. We don't claim any expertise in medicine. I'm the only doctor at Salesforce, the only MD at Salesforce. And so we realize that we're going to focus on the pipes, we're going to focus on the architecture, and then we're going to really open it up and make it available to the best of what's out there. Finally, just because this is a HIMSS group, we're going to be in Vegas. Well, actually, before I do that, there are a couple other places you can get information. Some of it's on the card, just so you can see it. Actually, I will call out, because I saw Paul here, there's a webinar on City of Hope that talks about some of the work we've done with a local provider in your area here, someone we're really proud to work with. And then finally at HIMSS, we're going to be at HIMSS this year. We're going bigger than ever. We've got all kinds of fun things planned, a session planned, a party, all kinds of other stuff. And so for any of you that are coming to Vegas in about a month, it's a month, right? We'd love to see you. So please check out some of our sources, check us out at the booth, and we'll continue the conversation. And part of that also is going to be the Salesforce Lounge that we're going to have about a mile away from the convention center, where we're going to have all kinds of great programming and great lunch. And chair massage too, I think. And with that, I'll end and offer if anyone wants to get in touch with me, feel free to get in touch with me, and I think we probably have some time for a few questions, yeah?